I'm presenting an ACTG study, A5375, which evaluated the pharmacokinetics of emergency contraception when used with efavirenz-based antiretroviral therapy. Effective contraception is an important concern for millions of women of reproductive potential. Levonorgestrel is a commonly used form of emergency contraception, and when given as a single dose of 1.5 milligrams within 72 hours after sex, that could lead to pregnancy, is expected to reduce the chances of pregnancy by 50%. LNG is metabolized via a cytochrome P453A4 isoenzyme and is thus subject to drug-drug interactions, especially when used with CYP3A4 inducers such as efavirenz and rifampicin. Some guidelines recommend doubling the dose of LNG to 3 milligrams when used with CYP3A4 inducers. However, the PK and safety of this strategy has not been evaluated. We therefore designed an open-label 4-arm parallel pharmacokinetic study to evaluate if doubling the dose of LNG overcomes the drug-drug interactions with efavirenz-based antiretroviral therapy or rifampicin-based anti-TB therapy. Today, I present the final results of the PK data for the efavirenz groups. We enrolled females living with HIV on efavirenz-based antiretroviral therapy for at least 30 days and randomized them in a 1:2 ratio such that 17 women received LNG as a standard dose of 1.5 milligrams and 35 women received a double dose of 3 milligrams at study entry. All participants were 16 years old and above, of reproductive potential. They were not pregnant and not currently requiring emergency contraception for their own medical care. All participants received the LNG dose at entry and underwent an intense 48-hour LNG PK monitoring. Safety assessments were also performed in person and weekly by telephone. LNG PK parameters were compared between groups by geographic mean ratio with 95% confidence interval. Table 1 presents the demographics and HIV characteristics of the study population. Throughout the poster, data in blue represent a standard dose group, and data in pink represent a double dose group. We enrolled a diverse population of women from different geographical areas across all BMI categories. Table 2 shows select PK parameters across each group which were compared by a GMR. Notably, there was a 55 to 133% increase in measures of LNG exposure observed with 3 milligrams versus the 1 milligram dose. No targeted severe adverse events were observed in either of these groups. In conclusion, doubling the dose of LNG increased measures of LNG exposure in females on efavirenz-based antiretroviral therapy by more than 50%, and yet it remains safe. These data support the recommendations to double the dose of LNG for individuals taking efavirenz-based antiretroviral therapy. We thank you.